All of our memory cares have support groups for families. The shrewd business person would say that's an unnecessary expense, right? I think it's the opposite of that. So there's a grieving process that our customers bring through the door. We start our customer relationship with most of them already in some form of a grieving process. It's my advocacy point. You should take that really seriously. That's a responsibility.
Senior living demand is rising. Occupancy is recovering. The aging wave is accelerating. But this week's guest believes high demand is masking a deeper issue: wide disparities in quality and a dangerous level of complacency among operators. From the president's seat of a multi-location senior living operations company, he argues that growth without discipline will not survive the next decade.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, founder of CCR Growth, the only demand generation agency that is exclusive to the senior living industry. And throughout this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations, strategies, and leadership insights that are shaping the future of the industry. So whether you're a provider, a caregiver, or industry leader, the show is here to help you make informed decisions and create meaningful impact. All right. Today's guest is Andy Lange. He's the president and founder of Wauwatosa, Wisconsin-based Koru Health, a senior living operations company. Over the past 20 years in healthcare, Andy has led lease-ups and stabilizations across numerous communities throughout Southeast Wisconsin, spanning independent living, assisted living, and memory care. With locations under management in Wisconsin and Minnesota, Koru Health continues to grow as a leader in senior housing and care. So Andy brings the perspective of someone who has worked his way through multiple roles in senior living and now leads from the president's seat, which is awesome. I love that journey. Now he's balancing operations. He understands about workforce strategy and long-term positioning in a high demand environment. This is going to be a great conversation. Andy, welcome to the show. I'm so glad to have you here.
Jerry, thanks for having me. It is an honor and a pleasure. I appreciate being invited to your platform to share about senior living. We need more of this, so appreciate your work on it.
Thank you. Yeah. I couldn't agree more. From the president's seat, I think there's a lot of perspectives that you have that trickle down, right? And not just in your organization, but for everyone sitting in that president's seat. We're in such a pivotal moment within the senior living industry right now with the silver tsunami at our back door, supply and demand crisis happening. There's all different things from an operations standpoint that make this a very unique, challenging time. Well, I think first just talking about the supply and demand piece of things. When we spoke last time, you expressed some concern about wide disparities in what families and employees were experiencing across operations. You had mentioned specifically in the Midwest. I'm assuming it's probably like that everywhere. The challenge right now, I think, is the fact that we're about to enter a space where demand is going to way outpace the supply that we have, which means that it's not a buyer's market, it's a seller's market. My first questions for you are we seeing complacency in the industry because supply and demand are out of balance, or is there some other operational shift that's happened that's causing that?
Yeah, what a great question. Great that you lead with this because it is a industry, so all of healthcare and a sector problem that is just it's big and, it's way beyond what operators, this isn't an operator problem is what I'm trying to get to. So the fact that you're opening your podcast with a topic that's, that heavy, it will impact all of the seniors that we all love in your own personal life is what your audience should hear. The answer to your question is in very basic form. Yes, there is a outcome to a sector that has rapidly growing customers and a finite inventory to serve said customers and all growth in terms of new product. I don't want to bounce around too much, but mergers and acquisitions is often measured. That is a net neutral function, right? So we try to talk about this often because it is quantifiable in terms of trending, how many new construction projects, new inventory is coming on regionally and nationally. No matter what you look at, Jerry, it is far under what demand will be. And then, so So that's just pure volume. And then within that, the acuity needs are rising rapidly. So then you're talking about a very special subset of talent and skills that the first comment is really geared toward real estate and inventory management.
Yeah.
That's multifamily type operators could talk that in circles with us. But then you add a layer of personal human touch, and then you add a layer of highly regulated context. It is a pretty big issue. But yeah, I think complacency is breeded by the dynamic of customers being lined out the door. And you kind of had it in your intro. You and I talked about this on our last discussion, and I appreciate that you're giving us a vehicle to talk about it. If you have a bad experience with a customer and you lose said customer, or the natural course of what happens with our customers runs its course, you get a reset really rapidly. And again, over time, that starts creating an environment where the only thing that's really keeping operators in check is regulations. This isn't like waving a flag like we think we're better. We have so much improvement to do and so much work to do. So that's not what this comment is, but we think regulatory is average, right? Compliance is a big C. We joke about it in our company. Capital C, we're average.
Yeah,
like, okay, you guys passed your state survey. Woohoo,
Bare minimum.
So where I'm trying to go is that's the only that's you have customers lining out the door. And like everyone who's savvy knows you can work your way around like social media reviews and online like those things can come and go. That's a pretty risky environment for frail people that are dependent upon us, right? So again, that's why the topic's so important. It matters, and it's a breeding ground for negative outcomes. And so we're trying to do it a little bit different. We're trying to understand that that's not a reason to be complacent. We should be doing better.
I've been in marketing for almost 3 decades, and through my agency, I've helped some of the largest senior living providers attract qualified leads and fill rooms faster while lowering their acquisition costs. But one thing kept bothering me. While working with larger communities, I kept meeting smaller operators, 10 to 50 bed communities that were struggling to compete with the big box providers because they don't have the same budget, staffing, or support behind them. And as a small business owner myself, I get that. You're wearing 5 different hats, you're trying to fill rooms while still giving great care, and that's exactly why we built Growthly. Growthly takes everything we've learned from helping large operators fill their buildings and makes it accessible to smaller communities without retainers, without long-term contracts or inflated costs. It's a performance-based partnership, and you only pay when we deliver move-ins. We help you stand out online, stop depending on referral agencies, bring in qualified families, and fill your community faster. Growthly is built for your small community and designed for big results. Learn more at growthlyseniorliving.com. No, that's great. That's perfect. I love your thought process there. From an internal perspective too, do you feel like, not internal to your organization, but just looking at like the operations side of senior living community, are operators falling short in ways that families may not even recognize? Are there things that are happening, from a management perspective that may not trickle down to them, but seems to be a pervasive issue across, other portfolios that you've seen?
Yeah. I think this answer, I want to continue to be humble. My answer is inclusive of my own organization, right? I don't know if there's anything that operators are failing at. I'm a person that tries to see the good in everything. Would it be naive to think that there aren't people in this line of work that are in it for the wrong reasons? Absolutely. That is existent, right? But I also like to think that most people that are in this and most people that are in ownership, most people that are working, they truly do want to do well. That's where my brain goes. Failing is a strong word for me, but yeah, I think there are things that are happening that families probably aren't even aware of. Again, the turnover of your customer almost creates an environment where you don't have to share that, right? And so I think what it actually boils down to answer your question, the industry has to continue to improve at a couple things, in my opinion. How do you consistently provide more and more individualized care? Because Jerry brushes his teeth differently than Andy does. And those are actually very personal things for you. So expand that upon any personal thing in your activities of daily life. And the industry calls it an ADL. All that stuff is super personal. And, so its core is serving people in the way that they want to be served. And from there, I think the industry has to figure out how do you consistently become responsive enough where you can manage changing regulations, changing market dynamics, responding to a very dynamic and a very challenging employee base, right? It is it is tough to compete. I think those are some key metrics that we try to focus on, like high level when we're trying to develop strategy. And how do you come up with techniques that you'll hear me talk about continuous improvement a lot. I sometimes feel like we have mountains to jump, but you know what? We're taking little hops. We're getting there. That's the continuous improvement mindset. It's like you can't get stuck. My partner, dear friend and partner at Matter Development side, talk about this all the time. If you get overwhelmed with the challenges in front of you, you will never succeed in this, particularly in this line of work, because those are constant, because you're dealing with human beings, right? You're dealing with human health decline, and that brings a lot of emotion. That's appropriate. It brings grieving process, right? So I think the answer to your question is trying to understand the deficits within our system and focus on individualized care. You know, you and I talked about operating consistently within an environment that has a high turnover. We're not the only sector that struggles with that. That's an example of what, operating consistently within these seemingly never-ending challenges that are in front of you. I think our whole sector doesn't move fast enough in that regard. Again, maybe a product of there's going to be a customer waiting for me, and maybe I can afford to not be as awesome as I would like to be. That starts to become a slippery slope, I think.
Well, I think you kind of hit the nail on the head too when you said micro improvements. I'm a big fan of James Clear and Atomic Habits and like the 1% improvement every day. I think he said something like if you improved 1% every day by the end of the year, you like 37x your output from the year prior or something crazy like that.
Yeah.
So I think that's probably what a lot of operators are doing is trying to make these big sweeping changes or waiting to make a big sweeping change rather than incrementally chipping away at things. And I mean, you can see for yourself what progress looks like when you are measuring those micro moments instead of just a big overhaul. In the supply and demand space too, I mean, talking about it from a development perspective, some of the data that I have or have been able to compile is from like early 2025. So I'm not sure if you're aware of any more recent data than this, but basically said like in Q1 of 2025, they were looking at like active units under construction in this sector, and there was only like 19,500 units actively being built. And that doesn't mean like they started in Q1. It just means like they were in some process in the construction. And then they said that in Q1 of 2025, there were only about like 1,500 units that were started in Q1 alone. So the data that I'm seeing
Isn't
in
that
terms
striking?
of it's crazy. I mean, the number of seniors over the age of 85 is supposed to increase by like 400,000 every year. If we take the average between now and like 2040, then that's like, so you just run those numbers and that means we need like 100 to 120,000 units every single year to be built to accommodate that influx. Have you seen different numbers? Have those numbers increased? Is there more development happening now? And if not, I mean, where are all these people going to go?
Yeah. I don't want to misquote anything. I actually think what you're sharing is better than what we've heard. I think your audience should hear the striking variance between the two. So whatever the exact number is, even if you're aggressive and say, okay, it's 20,000 against 400,000, right? I mean, it's just the gap, the gulf is humongous. So your question was really what now is what I hear, right? And
Yeah.
I think, and what people aren't really hearing that are outside of the sector is there is no way that you will not be able to overcome that now. You're not going to be able to build fast enough and finance fast enough to meet what is coming literally from today to like a decade out.
Mhm.
Another scary thing, passionate people like me that it's a joy to do senior living. I'm probably going to be exiting my career when it's peaking, like with a capital P. So what do you do now? Super, super dynamic industry and loaded question. So if I had to break it down, there's going to have to be some movement, the regulatory side. There are barriers and there are increasing barriers to affordable development. This is a vehicle for us to advocate as well. There are very limited programs that promote development of senior, which all you're doing is you're suppressing, right? Those are macro functions that are supposed to either promote, sustain, or suppress. It's my opinion that the public sector needs to dive in quickly and incentivize, right? And so the regulatory side could also be, we have to find compliant pathways to repurpose inventory that could otherwise be utilized. And again, so this is macro talk, but every available unit that could support healthcare services is eventually going to need to become an option. Like that's like the grand picture, like the pie in the sky, if you think about it that way. So your question is like, now what? You almost have to think of it as like, wow, what are the opportunities in front of us? How do we improve urban density access? There's a regulation in Wisconsin. It was actually a memo, but it undid decades of precedent in being able to develop a property or repurpose a property that can meet the highest level of assisted living. So that's before skilled care, before nursing care, because nursing care will never be able to meet this need. It's going to become the niche, and it already is. But just as an example, Wisconsin undid a long-standing building code requirement that allowed you to repurpose properties. It was a perfect vehicle. There's thousands of these buildings around Wisconsin, and you can check me. We have one of the safest life safety records in the nation. It is a dominantly negative thing for the development world. Like we literally had to pass on to urban area projects because we're not going to be able to do it now. Right. So again, regulatory side, I think, has to understand what's happening around us. And then I think operators have to find ways to do more with less. That is a bad problem in our industry. And I think they're going to have to understand your customers are going to need more than what like a license is going to allow you to do. So how do you continue to meet those demands? Because I think there will be a point where there's going to be nowhere to send someone, meaning now we've got outlets like you can send somebody to a rehab or a nursing home. I don't think it's that far-fetched that the healthcare demands of seniors is going to be so heavy. There might not be a lot of options. People could be, they might not have access. The gaps between the haves and have-nots is happening. Could you pay for anything you want and get it? Probably. Our sector will continue to accommodate that like most business does. But that's the exception. That is the exception to the norm. And our grandparents or our parents are going to be that population. Our parents are going to be in an environment where that's probably what senior care looks like. That's a little doomy gloomy though, Jerry,
Yeah,
But,
it is. It is. I mean, it's a mountain to climb for sure. And we don't necessarily have a path up it yet. I think we're figuring some things out, but and I'm sitting on the outside. I'm not sitting in all the boardrooms having these conversations. So for me, I'm just interpreting the data the way that I'm interpreting the data. But it's just interesting to me that this industry continues to lump the entire senior population together, this 65 plus cohort, and it's not.
no, it's not.
Most over 50% of people living in some type of community are over the age of 85. So that's the demographic that we really need to think about, because those are the ones that are going to increase. That's the population that between now and 2040 is going to more than double.
It's a disproportionate wave is
Yeah,
what you're pointing to. Yeah.
yeah. And
We don't discount. Discount is a good word. We don't discredit. We don't weight when we're doing market demographic work. We don't weight the 65 plus as heavily as many because of that reason. It's a little misleading. The true customers are like 75 to 100 actually. With disproportion of it is really like the 85 plus actually. Spreading services down the continuum is also going to happen. It's a big thing. We're working on that as we speak. The sector is going to evolve, and you're going to see, just like it happened early in my career, it was probably like 2000s or something. We had a lot of contraction of skilled nursing across the country, and Wisconsin also had that happening. Minnesota did too. You just kind of saw it kind of spread down the continuum, right? So I think, as an example, I think independent living environments are going to change rapidly in the next decade out of necessity. So that's another evolution that I think people that are watching the industry, your audience, will continue to see indicators that it's starting to happen. And technology, you'll see they're starting to outfit it where it is more monitoring. So there's like a passive, so you could use technology to do more and use less labor, like that. Those type of evolutions are going to have to happen, and you can kind of see it if you go to national shows. You'll see it's already happening.
It's really interesting. I just laugh because you always hear that data point that like actually less than 10% of the addressable market ever moves into senior living. It's like, yeah, when you look at the 65 plus, of course, because you've got people, now living into their 90s and their hundreds, they're not ready to move for the next 15 years, But
and they're
then if
staying
you
at
look
home.
yeah. I mean,
Cost containing.
I live in a community, it's 70% of this community is 65 plus, and none of them want to sell or move out of their houses. They're going to stay as long as they possibly can. I can't say I blame them.
I think the age of all of us is extending, and this is not a cheap pathway for residency in healthcare, unfortunately. So you also have a economic pressure that defers people moving into care settings, particularly, and even independent living continues to increase in cost of how you build them and what people are expecting. But the other side of this, we're continuing to work on how do we support market and customer education, right? Because if you continue to think through, like you're responding to what people want and are asking for and will pay for, there's going to be a breaking point sooner or later where you just can't do it and you're not going to get everything you want. So I think customer education, the true hard challenges and barriers in our sector is another important thing. So your podcast helps with that. I'm sure this reaches people, and we should be thinking about that type of stuff.
That's the goal.
Yeah, I know.
I
You're
hope
like,
people
that's my
listen.
business plan, Andy. That's exactly what I want. Thank you.
Yeah, yeah. No, it is interesting too. I think exactly what you're saying too, that the boomer generation, they're very particular about what they want. They don't want to move into the same place that their parents moved into. So they're looking for something new and fresh. But at the same time, if that supply is going to be short, then all of the amenities, all of the other things that we're offering, that's not going to appeal to as many people because of the affordability issue. Like if I'm moving in later and I'm price sensitive, I'm not going to look for the 5-star resort type senior living options. So I think like maybe building quicker, faster, simpler options, it does make sense. I don't want to devalue anybody's quality of life though. That's the thing. When you say stuff like that, it's like at the end of the day, we're talking about human beings here, and this is another stage in their life. We want them to live better. We don't just want them to find a place because they don't have anywhere else to go. That's not the goal either. So it's very, very complex.
Well, maybe to support you in your thought there, I would agree with you 100%. I think I would look at it as I believe we're doing this right now as well. I think this wouldn't be unique for a developer operator to be talking through the difference between function, needs, wants, and then what we would consider luxuries. I think those all impact a cost structure, which impacts your rate structure. So, I mean, I don't think it's crass or unthoughtful to have that mindset. That's part of why I made the comment of educating customers, right? It's like, well, we're all in this together. So if you want us to produce something that is the 5 stars and A class, there's a place for those. I don't think the entire population can receive that because it's not sustainable. I told you we have three rules in our company. One of them is, can we sustain this? Can we keep up with what we're saying? That's a sustainability problem. Like you can't make everyone a Cadillac. Is everyone driving a, whatever premium car you want? Is
Yeah.
everyone driving a souped up, Ferrari? Well, no. Same thing with, physical buildings and service lines. You're going to have to say like, well, what's the function that we have to meet here? What are their true needs? And then everything else, unfortunately, you have to think about the cost and return. Is it impacting their quality of life? Is it all those other things that come into play?
hmm Yeah. It's super complex.
It
Um,
is, right? I mean,
yeah.
we've been talking like, holy cow, we could just talk for hours.
Yeah. I definitely want to shift gears to something a little more positive.
Yeah.
Let's just talk about your leadership evolution a little bit. Last time we spoke, you described yourself as a blue collar kid who worked through multiple roles before you found Koru. So I wanted to just talk about the aspect of scaling and kind of shifting from just being an operator to kind of being an architect, right, of your organization. As you've evolved in your career, what leadership habits have you had to learn and which ones have you had to unlearn as your organization's grown?
Yeah, there's a lot there. So I appreciate the comment. Just to share with the audience, I was trying to just share a story because I am a blue collar kid. I would say the bottom end of blue collar. I'm humble enough to say I have received public assistance and I've worn hand me
Mhm.
down clothes. I also share the story because I want to. It's weird, Jerry. You're a business owner. I also want to try to uplift people and um, maybe I can inspire one young lady or young guy to look at senior and say, I could do that. Great. Join us.
Yeah.
So I do share the story because I'm proud of it, and I also share it internally. So we call our team members internal customers. I share it internally with customers to make sure they understand. At a minimum, I have some empathy because I have walked through it. Right, started my career, 20 years old as an intern at a public health operator in Wisconsin. I fell in love with what we do, right? So you're asking me about, the transition from that. I guess my response is I think it's an evolution. I've been continuing to grow. I'm an advocate of constantly learning. We promote it in our company. We have multiple people going back for advanced degrees right now, and we're paying for them because I think it's the right thing to do. And hopefully they stick around, Jerry. There's some strategy there.
Right.
But everyone around us is going to get stronger when they get stronger. I guess as I've moved through my career, I was blessed to have been given opportunities to learn management skills right away. I mean, I was fresh out of college, like literally running a property. And it's like, wow, I'm in over my head here. Like everyone's older than me and I'm getting old, but I had definitely like the baby face when I was younger. And, again, like who is this kid, this idiot trying to tell me what to do, right? Fast forward, becoming a seasoned professional, I think the jump for me most critical, there's so many things I could talk about. I think it was learning how to trust and still put proper guardrails in place. Not from a micromanagement, but to protect, right? It's like I can give you all the independence that you want, but if I don't have you in a position to succeed, we both lose. And so I think one of my most recent kind of growth things that I've gone through is really improving. There's no it's the continuous improvement mindset. I don't think you ever get to the point where you've mastered something. So I think I've really improved a lot on how to organize myself. So I give the right direction and I empower people to take that action and go with it. And then the learning point has been being able to release, because I am the operator and it's hard. It's hard to not get into the minutia when it's like, yeah, I know that stuff like the back of my hand. It's learning how to teach them to report up. So I know that the safety net is there and I can manage the 10% and then they can execute and lead and have autonomy and independence on the 90%. I think that aligns with unlearned. I think you have to unlearn when you're a really capable manager. I think when you get to my level, you have to unlearn having to physically do it all, right? And you have to unlearn that sometimes you have to let something sit for a few minutes and maybe it becomes less urgent on its own, right? This is hard because it's context driven, but sometimes there's a lot of value to doing nothing for a little bit and seeing, like, let's just see what happens here. And I think when I was earlier in my career, always like, I got to stay ahead of this. This is going to get worse.
Mm-hmm.
Or I wanted to be proactive. Like there was a healthy mind there. As a leader, this, right? It's like, you just don't have enough time in your day to do everything. Everything on my calendar is a priority or else it's not on my calendar type concept. So in the grand scheme of things, I think I've had to really unlearn and trust my ability to prioritize and say, yep, these need my immediate attention, improving our ability to delegate and trust team members and let them become a part of that fabric. If it all stops at one guy, one girl, one lady, you're in trouble anyway,
Yeah. I recently stepped up into the founder seat from CEO, and I find it's challenging to know where that line is for myself because I've, like you were saying, like wanting just to dive back in and doing certain things. I catch myself. I started out in graphic design, right? Like I was an art director. Those are the areas that I really thrived in for a long time. And I was the person doing that in my organization for a long time. So now, having the team that we have and not having to touch the things that I used to have to touch and staying, okay, you can stay in strategic mode. Like you don't have to worry about that stuff anymore. I'm continuously reminding myself of that. Is there something that you do that helps you understand like when you need to step back from like day-to-day oversight?
Well, it's not as structured as you probably would like to hear. I do try to listen and receive feedback, and my team makes fun of me for using this term, but it's always stuck with me. And I'm always aware of the outcome. If we're not doing very well at something and I'm the one like driving it, then I need to be like enough of a leader to say, yeah, I need some help here. Something's not working, right? So I don't like have a structure for it. We recently did some Clifton strengths assessment work internally. So there's a whole bunch of these, right? It's like the profile analysis. And, I've really tried to embrace the concept that I can. This is another thing that I've had to kind of unlearn. It's a time management thing. I really need to stay focused at the things that I'm really strong at, because then I can make the most impact with my time and surround myself with the people that are stronger at my deficits than I'll ever be, right? Buckets and buckets of energy and resources into your deficits, you're going to bring them up, a little bit. doubling down on your strengths, you're probably going to really become excellent at some stuff. So I've been trying to embrace that concept, and it's been working. Been going through a process. We recently hired a new director, and it's really allowing me to start giving operational control to another individual. And, I think our business is going to, from that. And that's a part of me understanding what I'm really going to be good at and what our organization really needs out of me as one of the team members, if you will. And we're a team, right? So it's like, that's the other concept behind it. So
Yeah, I love that. I think that's a good framework to have. It doesn't sometimes having more flexibility in the way that you're handling those situations, and just you're obviously learning more about yourself every day as you step further and further into this role. So I think that's great. The one position that I've seen a big shift in over the last decade, I think, is in the executive director role. I feel like now more than ever, there's kind of this expectation. They're almost seen as like the mini CEOs, right, of every community. It tends to be the case that they're either solid in operations or they're solid on like the marketing and sales side. It's rare that they're solid in both. And when you find those unicorns, you got to hold on to them. From an operator's perspective, though, how do you support EDs who might kind of lack that financial acumen that today's environment needs?
yeah, that's a great question. We prefer to have all around good people. Financial acumen, it's always going to be super important. I mean, you can't be lax about expense control, business development, revenue maintenance, revenue generation, census, sales. But we've been able to have EDs become very successful and consistent for us that may have otherwise been overlooked from a owner operator recruiting standpoint, because we understand that the financial acumen and the strength of that, it's just our experience. So I'm not knocking anyone, but we don't often find those two matching. Like you said it, I didn't even have to plant that seed. It's a unicorn, Jerry. So let's not be foolish and say we're going to continue to find those people. We have to figure out how do we operate, knowing that our ideal candidate probably doesn't have that actually, because it's most likely that they wouldn't have the other stuff that we want. So your question was, how do you support that maybe labor market deficit that just seems to be coming as a profile? Again, total stereotype. We just have some good systems in place where we watch, and then we have a monthly review. So there's a consistency there where it creates a safety net that talk through the financial reporting in a consolidated way. And we make sure we adjust that individually to the ED where we can continue to challenge them in ways where we know that they can receive it. And individualizes, I probably need to challenge Jerry, who has been doing this for 5 years and knows how to read a P&L and knows what his labor overtime is attributed to, blah, 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 versus somebody who's been in the industry for 2 years, or maybe he or she just joined our company. I might give that person a couple nuggets. It's a marathon game. I might really challenge Jerry, because Jerry, what is happening? You know that, right? It's a concept of individualizing your leadership, I think, a little bit. We also have, we're developing, it's continuing to evolve. We also have some confidence in just our metrics that we watch. Think of it as like a KPIs almost. I mean, we do a KPI dashboard. We have a lot of room to grow, but we're a little bit of the data nerds in our sector. There are others of us. It better informs your decision making. And I think it puts us on a path to be more consistent, because data tells you something and there's trends in that, and you can establish your own baselines and benchmarks within your own organization. And that lens, the applicability of that goes to everything, right? Clinical, the age-old problem, like how do you actually define quality? Well, doesn't mean it defines it, but it helps us understand what are we doing and how does that rack up against what is either expected of us or required of us or whatever. So we have KPI work that helps EDs that maybe would spend any enormous amount of energy trying to perfect that. Goes back to that Clifton Strengths exercise I talked about. I don't want an executive director who it takes an enormous amount of energy, effort, and time for them to figure out how to read a P&L in order to just make me happy or a director happy or something like that. I need them serving people, and I need them taking care of their team, and I need them running a compliant business. That would be really, in my opinion, that'd be kind of a big misuse of their talent by having them really work through something that's a big challenge for them, and it isn't a part of their natural skill set, their natural professional cloth, if you will.
Yeah. No, I love that. That makes total sense. You mentioned data. That merges perfectly into what I wanted to ask you about next, which was just AI and technology overall. I think at an operational level, I think we're at this point in time where everybody feels like they need to meet the moment, that if they don't get on the AI bandwagon right now, if they don't implement some of these technological shifts, they're going to get left in the dust. I don't know if reality is setting in for people yet, that it may not be as quick of a bubble as we might think it is in terms of the AI expansion. But I know, some of the data points I saw recently said like healthcare AI applications, they're projected to reduce operational inefficiencies. It said by 5 to 10%. I felt like that was really low. I feel like it's probably much higher than that, but realistically, I couldn't say for sure one way or another. But when you're operationally looking at implementing tech or AI or anything like that, how do you evaluate whether technology reduces risk or if it introduces new blind spots?
That's a great question. We know that I'm just calling it my word, there's a lot of like trendy happening around
Hmm.
AI and tech right now. And
Yeah.
honestly, we're trying to avoid that like the Black Plague. Not avoid tech. I'm saying having this professional like fear of missing out type thing that I'm feeling in the industry. Your intro to the question kind of laid it up for that. It's definitely happening. I think there might be operators that are fearing that they're going to miss out on like the next competitive edge to like get it to more applicable like comments. We're just not looking at it that way. We know we are adopting AI. We have a few initiatives underway. I think my brain, I'm a super nerd. My brain just works differently a little bit on some stuff. And on this, it's not that complicated. We've had big talks internally. It's like, let's boil it down, because nobody knows what's going on. Nobody knows what's going to happen in 5 years with AI. A lot of chatter happening, right?
Hmm.
There's a huge unknown, and we just can't afford, literally and figuratively, we just can't afford to take those kind of risks right now. Human lives are at stake, and it's like that old concept. If it's not broke, I'm not saying it's fixed, but if it isn't broke, like, let's not turn this thing upside down. Let's take steps, right? Let's take some steps, because we're working and we're doing fine. Do I have all kinds of things that I think we could be doing better? Absolutely. But that isn't a crisis where I have to make a really drastic decision and change like an operating model and introduce some unknown technology that, holy cow, like that's going to create a lot of risk. How do we know what's going to happen with that? All these questions, right? So that's the concept, how we're approaching it. So we're looking at any applications that would meet a necessity that are not, most of them are not going to even come close to our residents yet. So we're really looking at backhouse functionality, looking at it. Actually, with CCR growth, we are looking at some front end customer engagement tools that make a lot of sense. We've got two initiatives underway right now. One is technically a little bit of a tech startup, and it's can we use AI to better sort through data based on our criteria?
Hmm.
So I can rapidly improve my team's ability to make good decisions based on something that they can point to, and puts us in a position to be more proactive with some of our decisions. So that carries through to all kinds of stuff. I mean, it's rooted in some of our services and clinical, but it affects everything. It affects retention, labor. Are we aware that the new hire, your sensitive period, Jerry, is T minus 90 days? Are we even aware that that new hire had, I mean, you're going to know this will be an easy one. Like, are you even aware of the med passer that's struggling? Um, there's 12 incidents in 90 days. Is it the trainer? Is it that person not really getting their training? Like it just
Hmm.
didn't think? How does that impact retention when you can actually get ahead of that? Because an AI tool prompted you because you told it to, that manager is going to see that so much faster. And maybe that actually starts to move the needle. So we're looking at stuff like that. We're trying to automate a couple backhouse administrative tasks. We're integrating one with a SharePoint build out project with Microsoft, to streamline policy and procedures getting updated. You can plug in a regulatory change and it'll make recommendations on your updates to your policies and procedures. So things like that. Like, can I remove a little bit of the inefficiency in so right now, for audience purposes, like tangible, we have three initiatives underway. We're looking at it, we're working on it. We're trying to really be conservative. There's a cost behind it. I don't want to be wasteful, and we're just a little sensitive because there's so much unknown, and you only have so much bandwidth because there's a lot of people that need service and attention. Like, I can't have like these massive macro projects going on. Who the heck's going to do that, right?
Yeah.
Um, so hopefully that helps. Like it's a big thing. We're working on it. I think the next round is going to be on the tech front, and in my opinion, is improve savviness around data use and management. And I think that's going to lend itself to, and then the other trend I think is going to become more of a constant is using technology to make labor more efficient. I think we're really a long ways away from like a robot companion, in my opinion. I think there is some passive monitoring that is starting to come into our sector that from a concept standpoint, think of technology working our way back to almost like helping us triage, if you will. So can you really utilize labor more efficiently, which means maybe you don't need as much. You're still going to need it, almost present you with like a digital command center, if you will. Can like the data help us know when someone's about to hit a decline, be more responsive and better connected with someone who is declining, and be more reactive when there is a crisis underway, stuff like that, right? It's like right now, a lot of that type of stuff is reactive. You're manually getting an update from somebody on your floor, a nurse or something like that, or a family member. I think technology is going to put operators in a position where that stuff will be much more accessible to them. And hopefully that improves outcomes. I mean, that's our hope. And we're watching. There's a lot of products that are coming out of the market that indicate that could be the future for us.
Yeah, I love that because there's so much, like you're saying, reactivity where there should be proactivity. There's like predictive analytics and other tools that can be used right now. Yeah, even like for resident monitoring, their vitals and things like that, where those algorithms can essentially pinpoint when someone's temperature is raised by 1 degree for the last 2 days, something's going on in their system.
Right.
Having those type of biometric tools that can help monitor, but still maintain privacy, and I think is really important in this space. And one of the things I ask people a lot when we talk about tech, when it comes to senior living, I would say the industry overall is pretty slow with their adoption of technology. They're usually several years behind. And my theory always is that that's because our customer is not as tech savvy as the average person. You've got, of course, a lot of older adults, they're comfortable on tablets and smartphones, but they're not necessarily utilizing all of those advanced features. And even AI might just be something that would just, be
right,
way above their pay grade right now. I know with, future generations, obviously that's not going to be the case, but do you think that gap in tech knowledge is creating the, I guess, hesitancy for operators to adopt more tech quickly?
That word, tech knowledge. Can you,
Yeah.
do you have that trademarked yet? Tech knowledge.
No, but it's kind of cool.
Yeah, I think it's changing rapidly. I mean, we're trying hard to stay on the front end of it. So what we're trying to do is not overwhelm customers with too much. So if we can, that's kind of also another reason we've started kind of back house first. So I'll answer your question, but then it goes back to the blind spot a little bit. I think we're going to try, we've talked about this, we're going to try to approach it as, let's use technology to improve service so we can point to it. And then trust us, right? And can I use technology to improve engagement with it? So can I bring value through technology? And maybe that makes it a little less intimidating. And all the stuff we're looking at right now, we're not interested in invading people's personal space, dare I say yet, right? I don't know, see where the needs and demands of what we have to do evolve, but I don't feel that that's necessary. I think we're very interested in improved customer engagement tools. The affordability of all of this comes into play. Like, yeah, I'd love to do all of this stuff. You got to pay for it. And if I have to pay for it, I'm going to have to charge somewhere. You got to make enough money, right? So,
yeah.
Again, there aren't a ton of incentives outside of competing and making customers happy. There aren't a ton of incentives to like support this type of work with operators. So one of the blind spots is getting too excited about technology and not thinking through, having the sight lines. Like, it takes leaders to do that. Like, what is this going to do a year or two down the road? I'm not going to name names, but there are products on the market right now, as an example, that are creating AI-led notes through verbal dictation of an unskilled employee. They are taking and dictating notes that in some states are regulated functions that kind of start to tippy-toe into assessment, right? I heard a presenter, somebody asked a question. This is really great. I would save so much time. My caregivers can just talk. Yeah. And she said, well, they don't always chart that well. Can you fix that? Oh yeah, the AI auto corrects that. And in my head, Jerry, I was like, I just said something that was really relevant. Some of this stuff is regulated content, like the nurse is supposed to be doing that. Once you have a machine-led technology actually creating that charting in that note, I know they get approved, but it's all autopilot after click. Yep. Okay. They charted, click. The machine is actually dictating notes and care. And that starts to get a little dangerous. So there's regulatory implications of like technically not doing what you're supposed to be doing. And then there's some pretty negative outcomes potentially because it's only as good as that technology is. So yeah, I mean, I think for us, it's the blind spot is just that fear of unknown. We want to be more trusting of what's out there. It's just coming too fast. So how do we control it in a way that we know what it's going to impact? The risk is it doesn't work and we're using our old way of doing it or whatever. I think the public should also see that. It's like if you have that in front of you serving you and you're becoming dependent on it, let's make sure it's validated and proven a little bit first. So I don't know if that helps. That kind of jumped to mind a little bit.
Yeah, that'd be a hell of a thing for someone not to know that that was happening on the back end and then come to find out later that, you know, everything in the chart was misrepresented because the AI rewrote it the wrong way or something. That'd be
Yeah.
pretty scary.
And customer disclosure, right? So a question back to you, interviewer. Have you had the services where they announce that you're working with AI? And what's your take on that?
I'm glad that I was told up front,
Yeah,
so that
us
I
too.
understand. Yeah.
Yeah. So, again, part of it is evolving of, your original question was how are you helping and supporting your customers through that? It's being transparent and communicating with them and telling them like, this is how we're planning on using technology. So when we are implementing something new that touches them, I want them to be aware of it. I would rather know that I'm talking to a robot and it's okay, but don't lie to me. Make me think I'm talking to Jerry when it's, Jerry 2.0.
Oh, that makes total sense. Have you seen The Pit on HBO at all?
I haven't. Is it good?
It's all about an ER in Pittsburgh. But it's funny that you mentioned what you mentioned about the charting situation, because that's exactly what happens in season 2 is one of the attending physicians, she develops this app and tries to get all the doctors to start charting speaking into this app. And like 3 or 4 episodes into the show, they realize that all of the charts have information in there that's not even correct. And they've been like sending people to get tests or like medications that they weren't supposed to have. And it's just pure chaos, So I
Yeah,
thought that
that's
was
Hollywood,
interesting.
but like
Yeah.
that it's a facetious, exaggerated outcome of really what could happen. Like, yeah, you got a disaster on your hands. And again, we're talking about we're joking around here, but you're talking about a serious context. Like this is someone's life, and it's most likely a frail person, in our world. It's most likely a very frail person. So you don't have a lot of margin to screw up. Probably like the doctors in Pitt, I'm sure.
Yeah. Oh, I mean, it's high stakes, right? And AI's still got a hallucination rate that's still way higher than anyone would like in this space. I mean, I know in terms of AI, you could create a database where it's only looking at your information. It's not pulling from the outside sources, so you don't have to worry about that as much. But yeah, it's very costly, like you're saying, and challenging to build a system that would create that level of reliability where there wouldn't be some ethical concerns or liability concerns that would come out of using something like that. The other part, we were talking a little bit about predictive care. AI driven oversight is going to be a part of that, and it's going to grow over time too. Where's the line between protection and overreach? People talk about privacy, but then they also talk about wanting to know all these things. If like fall detection, things like that. Are we putting cameras in the room? Is it radar based? Like, where is that line for you?
That's a good question. I don't know if I've established the line outside of what, how we're approaching it, which is, maybe a little redundant, but we are very uncomfortable with anything that is taking away from a professionally credentialed individual's required like scope, right? So an easiest thing for your audience is like the nursing, the clinicians in our industry. I'm really uncomfortable with anything that is doing a task that they're required to perform. And then the second layer of that from a safety net standpoint is if I have anything that is affecting what my resident or my staff receive, I just really want to understand how far it can go, because then you kind of like you're giving control to the technology, right? So I guess for our point, we're trying hard to say the predictive like functions that are starting to happen are super cool. Like I'm not like, if anyone listening to this is a tech of it, that's not that's not the soapbox that we're on. We're a little fearful because it's an unknown territory also. It's not regulated. So like you don't know the litigation risk that this creates. Like there isn't a precedent for a lot of what's happening, right? And I don't want to be the one that sets that precedent. You know what meaning from like, well, there was a case in Wisconsin. I don't know.
Yeah.
It's like you just don't want to be
Yeah.
that leader without some protection. And right now that protection doesn't exist. The laws aren't aligned with really what could happen, and some of the technologies are evolving so fast that nothing is even in place to give you guidance on how is it supposed to be used. So for us, we are excited about it. Getting back to the point, we're working on a product right now that is, I talked about that KPI concept that we use.
Mhm.
We're working on some custom developed AI tools that will help us analyze those KPIs a lot faster. And that's what we're trying to get to. Can I get better information to the people that are capable and supposed to be doing this work rather than making this big leap and having technology do it for them? So the analysis, the aggregating of the data, the teeing it up, right? You can make recommendations based on the data that you find, but I think it needs to stop there. So like, we can report out on that. You can, have some alert that, based on blah, 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 like the tool is recommending that you take a look at that. But they still have to go do that function, I guess, is where we're kind of drawing the line for now.
That's a good, yeah. No,
We'll
that
see.
makes sense. There's obviously risk involved and not wanting to be a warning label. No one wants to be the warning label. I always think about like the Tupperware bins that when you lift the lid, there's the sticker of, no child, don't put the child in there. I'm like, who put the child in the bin? Like somebody
Exactly.
had to have done.
It's so funny you say that. My wife and I, we see stuff like that all over it, like in our normal life, just society. I'm like being observant, like, whoa, that means somebody did that. What I mean?
Yeah.
Like, I don't want to be
It's
a
crazy.
professional organization that went too aggressive and figured it out. And then we also set the precedent of like, you can't do that. Nope, we don't want to be that poster child.
Yeah. No, definitely not. I want to talk about your memory care program. I think you guys have done something really cool. You've built your own program where a lot of organizations don't necessarily do that. They either adopt someone else's or they don't necessarily have a program. They just offer memory care, which I think for prospective families, it's very hard for them to even conceptualize what that entails. What sparked that? Why did you build your own program instead of relying entirely on like a third party system?
Yeah. There's a lot of reasons why, but to be concise, I think we really wanted it to be custom to how we approach it. And we're evolving it literally as we speak. We're kind of revamping ours right now. There's a lot. So just a couple of reasons. We wanted to customize it is probably the biggest reason. We like a certain approach to memory care and dementia management. We also wanted to differentiate a little bit. We thought, if we could really have this thing be a program that people were involved in developing, this is the leadership in me. You get maybe a little more buy-in, right? Like there's some ownership of it versus I just opened up the box and here you got to look at these videos. Oh, and you get this little certificate at the end, right? That's so done, and
Yeah.
that might be acceptable.
Right.
Might be acceptable. We wanted to have our own spin on it. We wanted to have our thumbprint on it. And we also knew most likely we would be evolving and updating it. We are. I would say the early rendition was pretty tame. So I'll debunk one update to it. We're on our second update to our program and 8 years in, right? So that gives, audience a reference point of that continuous improvement thing that I've talked about. You got to live it in action. It's like, if you feel like, I was thinking about this podcast and I just had this thought in my brain about one of your questions. And, if you feel like you've made it, you don't know what you're doing. Because the customers are evolving, the market's evolving, the needs are evolving, the regulations are evolving. We see it as we achieve the goal. What's our next goal? Because you're not done with a dementia program. Because the research around dementia is evolving rapidly, right? So what you thought was the way to go 5 years ago, and I'm not being negative here, but you're super proud of your program. It's probably old news 5 years later. So I think, if any customers are listening to this, that's what you look for in a provider. How fluent are they in what's happening? You got to keep pace. The other side is a lot of customers are coming. So, if you're not paying attention, there's going to be a customer behind you type thing.
Yeah. How do you ensure consistency then across multiple communities when you have your own program?
Man, if I could if I could give you the silver bullet on that, I mean, holy cow, that'd be wizardry. It's challenging. Our sector shares this challenge with other sectors that have a lot of human-driven manual tasks. It takes caring people. It takes genuine people. It takes trustworthy people. For us, I think the best thing is we focus on training. We trying to continue to set, establish, and maintain a baseline. It at least gives us a foundation is kind of how we approach it. Okay, we use this term sometimes. Let's make sure we know where our basement is. Weakest link, you can use anything you want. Safety net, weakest link, basement. Where's my basement floor? Let's continue to, move it up. Okay, we got it. Micro step, move it up. And then how do we support the team members in a manner that we can retain them? So, that's the best answer to the question is knowing strategically, we're going to have a system that can manage consistent operation within a turnover environment because it happens. Even the best operators are going to experience 20, 30% turnover or something like that. So we already have to do that anyway. And does this really help us maintain consistency? I think it does. So, we do things like skills fairs. Our caregiver care, we call them care team members. Our care team member training is based on a CNA, Certified Nursing Assistant content program. And we have a digital training platform that keeps us compliant. But it's like I said, it's like kind of the paper record compliance. And we have a annualized schedule at all of our communities of monthly trainings that are in person, right? So for us, that's how we've approached it. It's going to continue to evolve. Maintaining competence and oversight. We found a lot of traction in training and making sure people continue to get the information that they should get.
Because memory care is far more complex than some other levels of care too, I mean, do you think there is anything that some executives might misunderstand about memory care operations?
That's another good question. I think my answer to that is probably understanding the disease first. So you mentioned something about just running a memory care community, right? Calling it memory care. Those do exist. If you don't know the progression of the disease and how it affects really everyone around it, it's a paradigm shift. We have, including myself, I'm a nationally trained dementia expert. We have 5 of them at our home office team, and our home office team is only 19 people. So as a percentage of how much value we put into it, it's pretty high.
Wow.
It's a paradigm shift. So for those that aren't intimately aware of what it does, we teach people you have to put yourself in their shoes because there are what we call absolutes within the disease process. And, Jerry is right if Jerry says blah, blah, blah. How do you support Jerry in that mindset, in that space? We have customers. I literally was at a community before our podcast. I'm back at our home office, but I was talking to one of our residents, and based on her decline, she thinks she's 30 years old. I know her son. I mean, he's almost retired. So again, I don't want to be rude. He's an older guy, and she was referring to her son as a kid today. So that is a paradigm shift. So your question was about operators, and I think too many people see the opportunity and they see the demand, they see the wave, and I can do that. I can warehouse seniors is what it actually becomes. And I hate that. I hate that so much. I think the true operators that are going to be hand over fist successful are going to understand the disease and train people to understand what it does. And how do you create an environment where they can be them in that moment of decline? They can be them, and it's okay. A wanderer, that's not a bad thing, Jerry. They're curious about their environment and they're walking around the environment. They're opening doors. Let them keep opening doors. It's okay. Because soon they're not going to be able to open the door. And that's it. It's like there's a use it or lose it concept that we teach families to use it because it's going to start to decline. Exercise that muscle. So again, I'm the owner, and I'm not sure that all owners could talk that intimately about dementia and having an understanding of it so you can build programming that supports it in a proper way. All of our memory cares have support groups for families. The shrewd business person would say that's unnecessary expense, right? Tried to frame it the right way. I think it's the opposite of that. I mean, these are people that are watching somebody that is actively declining. There's no cure for it, and it only gets worse. So there's a grieving process that our customers bring through the door. We start our customer relationship with most of them already in some form of a grieving process. it's my advocacy point. You should take that really seriously. That's a responsibility.
That's really insightful. Yeah, I mean, there's no cure, regression happening here with dementia, so at
There's
least
no
not yet.
rebounding.
Yeah. So, yeah. Yeah, I'm just I think from an operational perspective too, if someone doesn't understand the complexity of it, just the fact that like the average length of stay at a memory care community is like 18 months, it's not there's continuous turnover. So if you don't prepare or understand the complexity of that from an operational perspective, it's going to be difficult to maintain from a business perspective, maintain profitability, be able to continue helping as many families as possible. So
Yeah,
I love that you guys are doing that.
Yeah, that's a great point. I'll just give you another application. I mean, that what you just said, your stuff. What you just said matters. We budget capex work at a much more aggressive rate in memory care than we do assisted living environments, and differently in IL. An operator going into this thinking they can have that same model. Do you know what the upkeep of that turnover work requires? How fast those units get beat up compared to what you experience in a classic assisted living, M&Ms, meals and medication type environment. That creates environments that start looking really beat up, and they start not being the kind of place that you want to put grandma. Because again, that operator didn't understand these places get beat up quickly. We have one that's not even 5 years old, and we've already dumped a bunch of money into it because it needs it. You can't be on a 5-year cycle. You definitely can't be greater than 5 years. You should really be thinking like a 2 to 3 year window, because that's part of the population dynamic.
My last question for you, I think, just looking towards the future here. Um, I know that by 2034, there's going to be more adults over the age of 65 than there will be children in America for the first time ever. So clearly, there's going to be a major demographic shift. What do you think operators need to get right in the next 5 years to prepare for that?
Oh, that's a great question. I mean, I would nail it down to 3 things that we're trying to do. We're laying foundation now to be in the position of, I think, what you're saying. So one is finding ways that fit your capability as a business to expand what you're capable of consistently providing. Because I think the needs are going to grow. Every single customer we have is going to need more, and the volume of those single customers is going to become huge. So are you positioning yourself? It might take you, I've just used something, right? Like, it might take you 5 years to get to the point where you feel like you're going to be fluent and capable, but that customer is going to need it. I think 2 is being creative in the labor market. Um, the old, and this is like the ripple effect of what I'm about to say is you can apply it to almost anything in terms of your employment. We have to be able to accept and succeed with candidates that may have been not as desirable a few years back, or the atypical or whatever, non-typical, because the workforce is also declining at the same time. We're starting an initiative. We're planning for it. We have annual initiatives, and we break them into quarters. So we're planning to start an initiative in Q4 that is intentionally intended to attract older part-time workers. You have a whole growing group of, and as you pointed out, it's going to get bigger almost by the daily basis, of people leaving the traditional workforce that still want to have value and still want to give back. I believe that becomes a growing segment of the overall labor pool 5 years down the road. And I think, and there's more to that, but how do you develop systems that educate somebody who really in today's world has no business doing what we do, that kind of thing. How do you continue to find ways to overcome turnover, generate a little more revenue where you can make these roles more attractive? Can the operation become a little more sophisticated where maybe you're attracting a different kind of employee? So can I spread out my labor needs? It's all in like kind of set buckets today. Can I reduce the burden of one of those buckets by diversifying how the work actually gets done? It's a part of like how we're approaching technology. I think our operations is going to require some technology leaders in the near future. And I think that will indirectly start leveling off some of these kind of overwhelming needs that you have, like as the hands-on caregiver, as an example. And I think the third one is, I don't know how this one happens because it's so clear that there is a big gap. There really has to be a more macro discussion. And maybe it's a great point to end on. There really has to be a better macro discussion between public, private, regulators, and the customer. There's some pretty big problems. There's sustainability problems. And I think I'm just giving your audience an example. I think, we are an exceptional expense manager. You can't cut your way out of operating to a profitability point without sacrificing what you're delivering. And a lot of that stuff is pretty hard set. Like you can't do a lot of the stuff we do, like because it's required or your customer's demanding it. So I think for us, the third bucket, if I had to give you the crystal ball, there has to be some improved vehicles that get those conversations moving a little more aggressively, because there's a lot of barriers. And I think the impact that this is going to have on our greater society, I think, is pretty significant. I mean, the volume of seniors and how many extended families and lives are going to be impacted by this. The notion of families serving their own loved one, I think, is going to become a very real reality, where it used to be almost a norm. In other cultures, it's the norm. It's not in America. I think that discussion changes maybe a little further than 5 years, maybe a decade out. A lot of families are going to have choices, right? So I think, again, those discussions really need to start progressing. We're trying to do some advocacy work like that. If you have other owners and operators that listen to that, I really find your pathway to start promoting. Let's get some eyes and ears on this. We got to start having discussions, communities being around the concept that this is a sector that gets a lot of black eyes, but man, is it tough work, and there's a huge need, It's like, let's start having some more proactive discussions, and how do we support that industry rather than beating it up? But anyway, those are my 3 buckets of what I think people need to be thinking about now, and in that 5 to 10 year range.
Yeah, I love that. And none of this is going to be solved by one person. This is definitely a team effort. So I love the collaborative mindset that you have. So Andy, thank you so much. This was such a great interview. I really appreciate all your time. Where can our audience go to learn more about Koru Health or connect with you directly?
I appreciate your time. Again, a genuine enjoy talking to you. You're fantastic. We've had a couple chances to do that. So appreciate being involved and having an opportunity to talk with you. Easiest is probably koruhealth.org. You can reach out to us. We've got an info tab. It actually comes directly to me, and it comes to marketing and HR. So really, any reason you want to contact us, somebody will see it. It'll reach some eyeball. So if you're out there, love hearing from you. Reach out.
Awesome. All right. As we wrap up today's episode, I want to extend a huge thank you to Andy Lange for sharing his perspective from the president's seat, from workforce strategy and operational discipline to technology oversight and dementia specialization. This conversation challenges all of us to rethink what responsible growth really looks like in senior living. So if you want to connect with Andy or learn more about Koru Health, we've included his LinkedIn and their website in the show notes. As always, we hope you found this episode insightful and inspiring. And don't forget to subscribe to our podcast on your favorite platform, and stay tuned for more episodes where we continue to explore the evolving world of senior care, covering everything from leadership strategy and workforce development to innovation and the future of aging. And remember that From Leads to Leases isn't just an audio experience, we're a video podcast, so you can subscribe to our YouTube or Spotify channels to watch the full episodes. I'm Jerry Vinci, founder of CCR Growth. Thank you for joining us on From Leads to Leases. Please like, subscribe, and share this episode with anyone who might find it useful. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Andy.
Thanks, Jerry.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.